Medical Center, Dr. Kurt Campbell. Good morning. Nice to see you.
Good morning. You too.
So tell us in what cases you'd want to use the Whipple.
Well, it's an operation that's used for pancreatic malignancies that involve the head portion of the pancreas, or what we would call the periampullary region. So there's really 4 different malignancies that can occur in that area, either of the pancreas, the little ampulla itself, which is the insertion of the bile duct and the pancreatic duct into the duodenum. And so any one of those 3 cancers, as well as cancers involving the downstream portion of the bile duct, can be treated with that operation.
Obviously risks with any type of surgery, but are there extra risks associated with something like the Whipple?
Well, sure. So the operation really involves 3 parts. One, making sure the patient is truly an operative candidate, taking the tumor out, and then the reconstruction of all that plumbing that's been disturbed with the surgery itself. So bleeding because of major vascular structures in the area, leakage from some of the areas where we've connected things back together would represent significant risks.
But the benefits, talk about that.
Well, the benefits, there is no cure of any of those 4 malignancies I described to you that doesn't include that operation. So, which is good and bad. There is a surgery option available for those individuals. Sure, it would be great if they could be treated without that operation and treated to cure, but until that happens, the surgery represents a mainstay of their therapy.
All right, and definitely something that patients dealing with this should ask about when they go in, if their doctors are capable of performing the Whipple.
Absolutely, and this area here has a substantial concentration of high-volume centers that do that operation, and a number of highly trained surgeons in this area.
What a blessing that we live in an area with such talented doctors and good hospitals. Well, thank you so much for coming in this morning and explaining that procedure. And if you have any other questions or you would like a referral, just call 1-800-MD-MERCY. And then still ahead.